psychological distress is severe. Combined medical and psychiatric treatment can be necessary and appropriate for some individuals. The timeline of acne treatment has psychological implications. Understanding that improvements typically take 8 to 12 weeks reduces the despair of not seeing immediate results. Knowing that this is normal rather than treatment failure helps maintain consistency during the early phases when visible improvement hasn't yet occurred. Guide 29, Acne-Safe Cosmetics and Makeup, Products that don't trigger breakouts. For many people with acne, cosmetics worsen breakouts through pore clogging or ingredient irritation. Understanding acne-safe makeup and cosmetics allows you to use cosmetics without exacerbating acne. This is particularly important for those using makeup for confidence or professional purposes. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. This condition differs from acne triggered by other factors; it's purely product-induced. Recognizing whether your acne is acne cosmetica helps you address the root cause, stopping or switching the cosmetic product. Non-comedogenic labeling indicates products formulated not to clog pores or trigger acne in most people. However, non-comedogenic is not strictly regulated by the FDA, and what's non-comedogenic for one person might be comedogenic for another. Non-comedogenic labeling provides guidance but isn't a guarantee. Foundation is perhaps the most likely cosmetic product to trigger acne, as it's applied to large facial areas and remains on skin for extended periods. Silicone-based foundations often trap bacteria and sebum more readily than other formulations. Oil-free, water-based, or mineral foundations are generally better tolerated by acne-prone skin. Powder foundations allow better skin breathing than heavy liquid foundations. Additionally, looser application, don't cake it on, reduces pore clogging. Primers can exacerbate acne by creating an occlusive barrier over skin. If you use primer, choose lightweight formulations and don't over-apply. Some people with acne find that skipping primer entirely reduces breakouts without sacrificing makeup staying power. Concealers often contain heavy pigments and binders that can clog pores. Use sparingly, focusing concealer only on areas actually needing coverage rather than applying all over the face. Cream concealers are often heavier than stick or powder formulations. Powder concealers are generally lighter and better tolerated by acne-prone skin. Blushes in powder form are generally better tolerated than cream or liquid formulations. Mineral-based blushes are often less problematic than other types. Apply blush lightly; heavy application increases pore clogging risk. Setting sprays and powders can help prevent foundation migration while reducing the need for heavy foundation application. Light powder setting rather than additional product buildup can actually improve makeup longevity while reducing acne trigger risk. Eyeshadow, eyeliner, and mascara are less likely to trigger facial acne, unless you're rubbing your eyes and transferring product to your face. However, avoid eyeshadow that falls onto your cheeks or near your cheekbones where it might clog pores. Waterproof mascara and eyeliner can be harder to remove, potentially leaving residue that accumulates and irritates skin. Ensuring thorough removal of eye products is important. Lip products can contribute to acne in the perioral area. Heavy, occlusive lipsticks might trigger breakouts around the mouth. Lighter formulations and careful removal reduce this risk. Some lip products contain irritating ingredients that, while not technically triggering acne, irritate the perioral skin, making breakout appearance worse. Makeup brushes and applicators accumulate bacteria, dust, and product residue. Dirty brushes directly transfer bacteria and irritants to skin, worsening acne. Clean makeup brushes at least weekly with gentle shampoo or brush cleaner. Replace sponges frequently. Use clean hands or clean applicators when possible rather than dirty brushes. Removal of makeup is crucial. Leaving makeup on overnight allows prolonged contact with pores, promotes bacterial growth, and worsens acne. Thoroughly remove all makeup before bed using an appropriate makeup remover or cleansing oil, followed by your regular cleanser. Double cleansing, first with oil-based remover, then water-based cleanser, is particularly effective for completely removing makeup and sebum. Mineral makeup is often better tolerated by acne-prone skin than conventional makeup. Mineral formulations use zinc oxide, titanium dioxide, and iron oxides as pigments without some of the potentially problematic ingredients in conventional cosmetics. Many mineral makeup lines specifically formulate for acne-prone skin. BB creams and CC creams offer lighter coverage than full foundation while providing some color correction. These lighter formulations are often better tolerated by acne-prone skin than traditional foundations. If you need coverage, consider whether a BB cream provides adequate coverage before resorting to heavier foundation. Tinted moisturizers combine light coverage with hydration, often with less pore clogging potential than foundations. For those with mild acne or seeking light coverage, tinted moisturizers can be a good option. Sunscreen itself should be acne-safe. Many sunscreens worsen acne due to occlusive or comedogenic formulations. Specifically choose sunscreens for acne-prone skin, labeled non-comedogenic, oil-free, or for acne-prone skin. Mineral sunscreens are often better tolerated than chemical sunscreens. Testing new products carefully is essential. Introduce one new cosmetic at a time, using it for 1 to 2 weeks to assess whether it triggers new breakouts. If breakouts appear, discontinue the product and wait for acne to resolve before trying a different product. Testing one product at a time allows you to identify which products your skin tolerates. Some people find that minimizing overall makeup use helps control acne more than finding the perfect acne-safe products. If you use makeup only when necessary rather than daily, less product contact with skin means fewer breakout triggers. Consider whether you actually need all the makeup you're using or whether you could achieve similar results with less product. Professional makeup application services for special events often use heavy product application techniques. If you need professional makeup done, inform the makeup artist about your acne and request lighter application and acne-safe products if possible. Alternatively, request that you apply your own makeup at home after a professional provides guidance. The bottom line: find acne-safe products suitable for your skin, apply minimally, remove thoroughly, and use clean tools. This approach allows you to use cosmetics without significantly exacerbating acne. Guide 30: Building your perfect personalized skincare routine, complete advanced framework. After understanding numerous acne treatments and supporting strategies, integrating all this knowledge into a personalized, optimized skincare routine that works specifically for your skin is essential. This comprehensive framework guides you through creating your perfect routine. Step 1: Identify your specific acne profile. Are you primarily comedonal, blackheads, whiteheads? Inflammatory, red pimples, pustules? Hormonal, deep cystic lesions? Severe mixed type? Fungal acne. Acne cosmetica. Your acne type guides which treatments are most appropriate. Comedonal acne particularly benefits from salicylic acid. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Fungal acne requires antifungal treatment. After 1 to 2 weeks of consistent use, inflammatory acne should appear less red and swollen. After 4 weeks, you should see significant improvement in the number of inflammatory lesions. Full results typically appear after 6 to 8 weeks of consistent use. Long-term use of benzoyl peroxide is safe and very common. Many people successfully maintain clear skin for years using benzoyl peroxide as their primary acne treatment. However, some dermatologists recommend occasionally taking breaks from benzoyl peroxide, perhaps 1 week per month, to allow your skin's natural bacteria to repopulate normally. This isn't absolutely necessary, but some people find it helpful in maintaining overall skin health. One important consideration: never use benzoyl peroxide with vitamin C or niacinamide at the same time, as benzoyl peroxide can oxidize these ingredients, reducing their effectiveness. Apply these ingredients in the morning and benzoyl peroxide in the evening, or use them on different days. Guide 6, Retinoids, the gold standard anti-aging and acne treatment comprehensive guide. Retinoids represent the gold standard in skincare science, with decades of research supporting their effectiveness for acne, aging, and general skin health. Understanding retinoids' mechanism, types, concentrations, and proper use is essential for anyone serious about achieving clear, healthy skin. Retinoids are vitamin A derivatives that work through multiple powerful mechanisms. First, they increase cellular turnover, causing your skin to shed old cells and reveal fresh, new skin underneath. This prevents dead skin cell accumulation that leads to clogged pores and comedones. Second, they normalize sebaceous gland function, helping regulate sebum production. Third, they stimulate collagen production, improving skin elasticity and minimizing fine lines. Fourth, they have anti-inflammatory effects, reducing the redness and irritation of acne. Fifth, they prevent follicular hyperkeratinization, the abnormal cell shedding that contributes to acne. Sixth, they have antioxidant properties, protecting skin from free radical damage. The retinoid family includes various types at different strengths. Over-the-counter retinol is the gentlest form, requiring conversion by your skin's enzymes to the active retinaldehyde and then to retinoic acid. This multi-step conversion process makes retinol gentler but less immediately effective than prescription retinoids. Retinol, retinaldehyde, is slightly more powerful than retinol, requiring one fewer conversion step. Prescription retinoids include tretinoin, Retin-A, adapalene, Differin, and tazarotene, which are already in their active form and thus more powerful and faster acting than over-the-counter options. For someone new to retinoids, starting with over-the-counter retinol at a low concentration, 0.25 to 0.3%, is typically appropriate. This allows your skin to build tolerance gradually. After several months of consistent retinol use, you might consider asking your dermatologist about prescription retinoids for enhanced results. Retinoids are only used at night because they increase sun sensitivity substantially. UV exposure dramatically increases the risk of photosensitivity reactions and post-inflammatory hyperpigmentation. Morning retinoid use would leave your skin vulnerable to severe sun damage throughout the day. When starting retinoids, begin with a very conservative approach. Use a low-concentration retinol product just 2 to 3 times per week initially. Apply it to completely dry skin, as retinoids irritate damp skin significantly. Wait 20 minutes after cleansing before applying retinoid to ensure your skin is completely dry. Use a pea-sized amount for your entire face. Retinoids are potent and a little goes a long way. During the first 4 to 12 weeks of retinoid use, expect a retinization phase characterized by redness, peeling, flaking, and sometimes temporary worsening of acne. This is normal and doesn't indicate that retinoids aren't appropriate for you. This phase typically lasts 2 to 8 weeks and gradually resolves as your skin adapts. Many people who discontinue retinoids during this phase miss out on their incredible long-term benefits simply because they couldn't tolerate the short-term adjustment period. Managing retinization involves strategic moisturizing. Use your retinoid, then wait about 20 minutes, then apply a hydrating moisturizer over top. Some people layer their moisturizer directly on top of wet retinoid serum, which dilutes the retinoid slightly and reduces irritation. This is called the sandwich method. This method is appropriate when dealing with significant irritation. As your skin adapts, you can gradually stop using the sandwich method. Never combine retinoids with other strong actives initially. Using retinoids with benzoyl peroxide, salicylic acid, or chemical exfoliants on the same evening will cause severe irritation. Once your skin is adapted to retinoids alone, typically after 8 to 12 weeks, you might carefully introduce another active on different evenings. Eventually, some people successfully combine retinoids with other treatments, but build up to this gradually. Vitamin C and other antioxidants can be used with retinoids. Apply vitamin C in the morning and retinoids at night, or apply them on different days. Niacinamide can be used with retinoids in most cases, but some people find them together irritating initially. SPF 30+ broad-spectrum sunscreen is absolutely mandatory every single day when using retinoids, even if you don't plan to go outside. Window glass blocks most UVB rays but not UVA rays, meaning significant sun damage can occur even indoors. Reapply sunscreen every 2 hours if you'll be in the sun. Wear protective clothing, hats, and sunglasses when possible. The combination of retinoid use and sun exposure can cause severe reactions and permanent skin damage. As your skin adapts to retinoids over 8 to 12 weeks, gradually increase usage frequency. After tolerating 2 to 3 times weekly for 4 weeks, increase to 3 to 4 times weekly. After another 4 weeks, increase to 5 to 6 times weekly. Eventually, many people use retinoids nightly. This gradual progression minimizes irritation and maximizes adaptation. If you experience severe irritation, excessive peeling, or significant discomfort at any point, reduce back to a lower frequency. There's no rush. Building retinoid tolerance over several months is perfectly acceptable. Consistency matters far more than speed. Someone using retinol 2 to 3 times weekly for years will see better results than someone who uses it daily for 2 months then stops. Results from retinoid use appear gradually but are remarkable. After 4 weeks, you might notice smoother texture and reduced comedones. After 8 weeks, reduced acne and early signs of improved skin tone. After 12 weeks, significant acne improvement, smoother texture, and visibly improved skin. After 6 months, improved fine lines, more even skin tone, and dramatically clearer skin. After 1 to 2 years, comprehensive skin improvement including acne prevention, minimal fine lines, even skin tone, and visibly healthier, more resilient skin. Prescription retinoids like tretinoin work faster than over-the-counter retinol. Starting tretinoin at 0.025% and increasing gradually can show acne improvement within 6 to 8 weeks rather than 12 weeks. However, prescription retinoids cause more significant initial irritation, making the starting process more challenging. Many dermatologists recommend beginning with over-the-counter retinol to build tolerance, then switching to prescription retinoids if additional strength is needed. Retinoids are teratogenic, meaning they can cause birth defects if used during pregnancy. Women of childbearing age should use reliable contraception when using retinoids and should discontinue use if planning pregnancy or if pregnancy is suspected. Men can use retinoids without this concern. Common mistakes with retinoids include starting with too high a concentration, using them too frequently initially, applying to damp skin, using them with too many other actives, or discontinuing them during the retinization phase. Starting right requires patience and conservative progression. The reward for proper retinoid use is clear, youthful, healthy skin that continues improving even after years of use. Guide 7: Hormonal Acne in Women, Causes, Recognition, and Comprehensive Medical Management. Hormonal acne is a distinct type of acne that affects many women and some men, following predictable patterns related to hormonal fluctuations. Understanding hormonal acne's unique characteristics and treatment approaches is essential for women struggling with acne that doesn't respond adequately to standard topical treatments. Hormonal acne typically appears as deep, cystic lesions, often concentrated around the jawline, chin, and lower face. These lesions are painful, tender to the touch, and located deep within the skin rather than on the surface. They're often described as having no head, meaning they don't develop the white or yellow center that surface pimples have. They can persist for weeks in many skincare products. While peptides aren't primary acne treatments, they support overall skin health and resilience. They're generally gentle and well tolerated. Include peptides in your routine for general skin support without expecting them to treat acne directly. Hyaluronic acid is a humectant that holds up to 1,000 times its weight in water, providing significant hydration. While it doesn't treat acne, maintaining proper hydration through hyaluronic acid improves skin function and barrier health. Using hyaluronic acid serums or moisturizers provides hydration support for acne-prone skin. Squalane is a lightweight oil that mimics skin's natural sebum without being comedogenic in most individuals. It provides hydration and lipid support for barrier function. Squalane is particularly useful for acne-prone skin that needs lipid support without the pore-clogging risk of heavier oils. A few drops of squalane can be added to moisturizer or serum for enhanced hydration. Niacinamide, vitamin B3, has multiple beneficial effects for acne-prone skin. It has mild antibacterial and anti-inflammatory properties, reduces sebum production, minimizes pore size, and strengthens the skin barrier. At 4 to 5% concentration in serums or moisturizers, used daily, niacinamide provides noticeable benefits. It's also gentle enough to use with other actives without concern. Alpha-lipoic acid is a powerful antioxidant that penetrates both water and lipid layers of skin. It reduces inflammation, supports barrier function, and has some evidence for acne reduction through anti-inflammatory mechanisms. Alpha-lipoic acid is typically used in serums at 5% concentration, applied daily. It's generally well tolerated but can cause mild irritation in very sensitive skin. Ferulic acid is a plant-derived antioxidant that works synergistically with vitamins C and E for enhanced antioxidant protection. Ferulic acid also has direct anti-inflammatory effects. It's commonly found in advanced serums and provides additional antioxidant support beyond vitamin C alone. Resveratrol is a potent antioxidant from plants like grapes. It reduces inflammation and has some antimicrobial properties. While not a primary acne treatment, it provides useful antioxidant support. Resveratrol is often combined with other antioxidants in advanced serums. Bakuchiol is a natural retinol alternative derived from the babachi plant. It provides retinol-like benefits including increased cell turnover, collagen stimulation, and anti-aging effects without being a true retinoid. Importantly, bakuchiol doesn't cause photosensitivity or irritation like retinoids, making it suitable for very sensitive skin or as an alternative for those who can't tolerate retinoids. For acne specifically, bakuchiol is less powerful than tretinoin or retinol, but provides useful cellular turnover support. Salicylic acid analogues include beta-hydroxy acids beyond standard salicylic acid. LHF, lipohydroxy acid, is similar to salicylic acid but slightly milder, making it suitable for sensitive skin. These salicylic acid analogues provide exfoliating benefits with potentially less irritation than standard salicylic acid. Azelaic acid, beyond its use for hyperpigmentation, has direct acne-fighting properties. At 10 to 15% concentration, azelaic acid has antibacterial, anti-inflammatory, and anti-keratinizing effects. It's a versatile ingredient useful for acne, rosacea, and post-inflammatory hyperpigmentation simultaneously. Botanical extracts like tea tree oil, witch hazel, and green tea have mild antibacterial and anti-inflammatory properties. While weaker than pharmaceutical actives, they provide supportive benefits. Many skincare products combine multiple botanical extracts for cumulative benefit. These are generally well tolerated, making them suitable for sensitive skin seeking some acne support without strong pharmaceutical actives. Retinaldehyde, also called retinol, is a retinoid intermediate between retinol and retinoic acid. It's slightly stronger than retinol but weaker and less irritating than tretinoin. For those finding tretinoin too strong or seeking stronger benefits than retinol provides, retinaldehyde is an excellent middle ground. It's increasingly available in advanced skincare products. Encapsulation technology makes some ingredients more stable or less irritating. Encapsulated retinol, for example, releases gradually over time, reducing irritation while maintaining effectiveness. Similarly, encapsulated vitamin C remains stable longer and is less irritating than non-encapsulated forms. Time-release technology delivers ingredients gradually rather than all at once. This reduces initial irritation while providing extended benefits. Some treatments use time release to deliver benzoyl peroxide or salicylic acid gradually throughout the day. Polyhydroxy acids, PHAs, like gluconolactone and galactose are gentler exfoliants than AHAs and BHAs. PHAs have larger molecular structures that penetrate more slowly, making them suitable for sensitive skin or those who can't tolerate standard exfoliants. They provide exfoliating benefits with less irritation. Using cosmeceuticals strategically enhances your acne regimen. For example, you might use salicylic acid for exfoliation, benzoyl peroxide for bacterial control, then add niacinamide serum for sebum control and barrier support, followed by a hyaluronic acid serum for hydration and a moisturizer with peptides for skin support. This multi-ingredient approach addresses multiple aspects of skin health. However, avoid the trap of skincare complexity. More products don't automatically mean better results. Focus on core treatments: cleanse, treat with proven actives, moisturize, protect, then add supportive ingredients. A simple routine with proven actives beats a complex routine with unproven ingredients. Guide 28: Acne and Mental Health, Psychological Impact and Management Strategies. Acne's psychological and emotional effects are profound and often underestimated. Understanding acne's mental health impact and implementing strategies to manage the psychological component is essential for overall well-being during acne treatment. The psychological burden of acne is real and significant. Studies consistently demonstrate that acne causes depression, anxiety, reduced self-esteem, and social withdrawal in many sufferers. This burden is disproportionate to acne's physical severity. Even mild acne can cause substantial psychological distress, while severe acne might cause less psychological impact in individuals with resilient self-image. Visible acne, particularly on the face, affects how others perceive you and how you believe others perceive you. This perception, whether accurate or not, influences social interactions and self-confidence. Many acne sufferers report avoiding social situations, dating, or professional opportunities due to acne-related anxiety. Some experience body image disturbance and depression stemming from acne. The unpredictability of acne exacerbates psychological distress. Not knowing when breakouts will occur, having acne that doesn't respond to treatment despite best efforts, and experiencing setbacks after progress all contribute to frustration, helplessness, and depression. The search for the right treatment becomes emotionally exhausting. Acne's psychological impact justifies aggressive medical treatment even for acne that isn't technically severe by dermatological standards. If acne causes significant psychological distress, depression, or anxiety affecting quality of life, treatment should be pursued regardless of how many lesions you have. Your mental health is legitimate reason for professional acne treatment. Several psychological strategies help manage acne-related distress. Cognitive reframing involves recognizing and challenging negative thoughts about acne. Rather than, "Everyone will think I'm disgusting because of my acne," reframe to, "Most people don't notice my acne as much as." While actual isotretinoin-induced depression is rare, patients do report mood changes, and there's ongoing debate about causation versus correlation. Patients with personal or family history of depression should discuss this risk carefully with their dermatologist. Many dermatologists don't prescribe isotretinoin to patients with untreated depression or psychiatric conditions, or do so with additional psychiatric monitoring. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in iPledge. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Noncompliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Guide 22, Oral Antibiotics for Acne, Types, Mechanisms, Resistance, and Long-Term Management. Oral antibiotics have been acne treatment staples for decades, effectively controlling moderate to severe inflammatory acne. Understanding antibiotic options, their effectiveness, the critical issue of antibiotic resistance, and appropriate usage patterns is essential for optimal acne treatment. Oral antibiotics treat acne through multiple mechanisms. First, they kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, they can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential side effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in iPledge. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Noncompliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special, Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided, though new evidence suggests safety. Potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible, though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin, some. Routine predictability helps sensory-sensitive individuals. Consistent routines in consistent order reduce sensory overwhelm compared to variable routines. Minimal product routines, fewer products means fewer sensory inputs, might be better tolerated than complex multi-step routines. A simple cleanse, treat, moisturize routine might work better than elaborate routines. Fragrance sensitivity affects many products. Fragrance-free or lightly scented products work better for fragrance-sensitive individuals. Sensory-friendly product recommendations: lightweight serums, fragrance-free formulations, smooth-absorbing products, minimal texture variations, consistent temperatures, and routines. Professional guidance from dermatologists familiar with sensory sensitivities helps develop manageable treatment plans. Guide 90, Acne and Chronic Illness, Managing Acne while Managing Other Conditions. People managing chronic illnesses, diabetes, autoimmune diseases, chronic fatigue, etc., face additional challenges managing acne alongside other health concerns. Chronic illness causes stress, sleep disruption, and immune dysfunction, all acne worsening factors. Flares of underlying chronic conditions often coincide with acne worsening. Medications for chronic illnesses sometimes interact with acne treatments, requiring careful coordination. Energy limitations from chronic illness might make complex skincare routines unsustainable. Simplified routines are sometimes necessary. During chronic illness flares, simplifying skincare to basic cleanse protect routines is appropriate. During periods of better health, more comprehensive acne treatment is possible. Mental health in chronic illness overlaps with acne's psychological burden. Both require professional support. Healthcare provider coordination between specialists treating chronic illness and dermatology ensures appropriate care. Prioritizing which health concerns to focus on during periods of limited energy helps. Sometimes managing underlying chronic illness takes priority over aggressive acne treatment. Guide 91, Acne Treatment and Vaccination, Timing and Considerations. Concerns sometimes arise about acne medication interactions with vaccines or vaccine effects on acne. Most acne treatments don't interact meaningfully with vaccines. Topical treatments have minimal systemic absorption and don't affect vaccines. Oral antibiotics for acne don't affect vaccine efficacy. Vaccines should be given as scheduled regardless of antibiotic use. Isotretinoin doesn't interact with vaccines, though the immune system suppression during severe acne might theoretically reduce vaccine efficacy. Live vaccines are contraindicated during isotretinoin use due to theoretical immunosuppression risks, though actual risks are minimal. Some vaccines might cause temporary acne flares through immune system activation. This is temporary and doesn't indicate vaccine problems. Vaccines don't cause persistent acne. Any acne appearing after vaccination is likely coincidental timing rather than vaccine-related. COVID-19 vaccines have not been shown to affect acne or interact with acne treatments. Timing vaccines around acne treatment is generally unnecessary. Vaccinations and acne treatment can proceed on standard schedules without coordination. Guide 92, Acne Prevention in High-Risk Children and Adolescents. Children with strong family history of severe acne are at high risk for developing severe acne. Early prevention strategies might prevent progression to severe acne requiring aggressive treatment. Starting gentle skin care routines early, non-comedogenic cleansing, sun protection, gentle moisturizing, establishes good habits before acne develops. Education about acne prevention helps young people understand triggers and prevention even before acne appears. Stress management skills learned early help reduce stress-related acne worsening later. Healthy diet and sleep habits established in childhood support skin health throughout life. Early intervention at first signs of acne prevents progression. Some dermatologists recommend seeing high-risk children early for preventive guidance. Avoiding triggers identified through family acne patterns, particular foods, products, environmental factors, might prevent acne development. Psychological preparation for potential acne, normalizing that acne is common, reducing stigma, helps adolescents manage it psychologically if acne develops. Guide 93, Acne in Performing Arts and Image-Dependent Professions. Performers and those in image-dependent professions, models, actors, social media influencers, experience unique acne-related pressures warranting specialized management. Career-threatening pressure intensifies acne's psychological impact. A small breakout affecting someone's livelihood differs from same breakout's impact on others. Professional makeup demands acne coverage requiring heavy makeup potentially triggering acne cosmetica. Using non-comedogenic makeup and proper removal helps minimize this. Professional headshots and promotional photos emphasize clear skin. Acne interferes with professional image management. Scheduling professional appearances around acne cycles when possible helps. If acne is cyclical, scheduling performances during clear phases. Professional dermatology involvement is often valuable for ensuring consistently clear skin during critical professional periods. Some performers use preventive acne treatment intensification before important performances, temporarily increasing treatment frequency. Mental health support helps manage the intensified appearance pressure these professions create. Guide 94, Acne and Sleep Disorders, Managing Acne while Managing Sleep Issues. Sleep disorders, insomnia, sleep apnea, restless leg syndrome, create multiple acne worsening factors making acne management more challenging. Sleep deprivation from any sleep disorder worsens acne through stress hormone, immune, and inflammatory mechanisms. Sleep medications sometimes worsen acne. Discussing with sleep specialists whether acne worsening might relate to sleep medications is appropriate. Treating underlying sleep disorders often improves acne significantly through improved sleep quality and stress reduction. Managing both sleep and acne requires comprehensive approach addressing both conditions. CPAP machines and other sleep disorder treatments might trigger acne through skin irritation. Using protective barriers and keeping equipment clean helps. Guide 95, Acne and Fertility, Female and Male Considerations. Acne treatments have fertility implications requiring consideration for those planning pregnancy or concerned about fertility. Isotretinoin is highly teratogenic and absolutely contraindicated in pregnancy. Women of childbearing age must use reliable contraception while on isotretinoin. Spironolactone might affect male fetus development. Stopping spironolactone while planning pregnancy or if pregnancy occurs is generally recommended. Birth control pills used for hormonal acne obviously affect fertility planning. Stopping pills when planning pregnancy allows pregnancy attempt. Other acne treatments don't significantly affect fertility and can be continued during fertility attempts. Male fertility is theoretical hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, antiandrogen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 63, Acne in Patients with Liver Disease and Metabolic Disorders. Liver disease and metabolic disorders can affect acne through various mechanisms. Managing acne in these populations requires special consideration. Liver disease affects hormone metabolism, potentially worsening hormonal acne. Patients with cirrhosis or chronic hepatitis often have worsened acne due to impaired estrogen metabolism and altered hormone regulation. Metabolic syndrome, combination of obesity, insulin resistance, hypertension, and dyslipidemia, correlates with worse acne. The insulin resistance driving metabolic syndrome increases androgens and sebum production, worsening acne. Managing metabolic syndrome through weight loss, exercise, and dietary changes often improves acne. PCOS involves insulin resistance and is therefore associated with metabolic syndrome and worse acne. Managing PCOS-related acne involves addressing insulin resistance through diet, exercise, and potentially medications like metformin. Diabetes, particularly poorly controlled diabetes, worsens acne through multiple mechanisms: inflammation, immune dysfunction, altered wound healing. Optimizing diabetes control improves acne. Liver metabolizing medications used for acne, like spironolactone, oral antibiotics, require dose adjustment in liver disease and monitoring for side effects. Patients with liver disease should have liver-specific dosing guidance from their healthcare providers. Hepatotoxic medications, like isotretinoin, which requires liver monitoring even in healthy individuals, should be used cautiously or avoided in patients with liver disease. Baseline liver function testing and monitoring are essential if used. Weight loss, if overweight, provides multiple benefits including acne improvement through metabolic and hormonal mechanisms. Lifestyle interventions addressing metabolic health support both acne management and overall health. Guide 64, Acne in Patients with Polycystic Ovary Syndrome, PCOS, Comprehensive Management. PCOS is a common hormonal disorder strongly associated with acne. Understanding PCOS-specific acne management optimizes outcomes for affected individuals. PCOS involves androgen excess, ovulatory dysfunction, and typically insulin resistance. These factors combine to cause often severe acne, frequently concentrated on the lower face and jawline. Hormonal testing for PCOS includes elevated androgens, elevated LH with normal or low FSH, and often elevated fasting insulin and insulin resistance markers. Pelvic ultrasound might show polycystic appearing ovaries. Acne in PCOS often differs from typical hormonal acne in severity and resistance to standard treatments. Many PCOS patients with acne require systemic hormonal treatment for adequate control. Birth control pills are first-line hormonal treatment for PCOS acne, with formulations containing low androgenic progestins preferred. Typical acne improvement occurs within 3 to 6 months. Spironolactone provides additional androgen reduction when combined with hormonal contraceptives. The combination often provides better acne control than either alone. Metformin, while primarily treating insulin resistance, can modestly improve acne by improving metabolic parameters and potentially reducing androgens. Typical dosing is 1,000 to 2,000 mg daily. Lifestyle interventions are particularly important in PCOS. Weight loss even if overweight, or weight management if normal weight, improves insulin sensitivity and androgen levels, often improving acne significantly. Exercise, particularly resistance training, improves insulin sensitivity. Dietary modifications emphasizing low glycemic foods support metabolic health. Comprehensive PCOS acne management combines hormonal contraceptives, spironolactone if needed, metformin if insulin resistant, lifestyle optimization, topical acne treatments, and potentially professional treatments. This multifaceted approach addresses both the underlying PCOS pathophysiology and surface acne manifestations. Many women with PCOS achieve significant acne improvement through this comprehensive approach even if acne was previously treatment-resistant. The key is addressing underlying PCOS rather than only treating surface acne. Guide 65, Acne in Patients with Psychiatric Conditions, Medication Interactions and Mental Health Considerations. Psychiatric medications sometimes worsen acne or interact with acne treatments. Additionally, acne's psychological burden is heightened in individuals with pre-existing psychiatric conditions. Managing acne in this population requires coordinated psychiatric and dermatological care. Lithium, used for bipolar disorder, causes acne in many patients. This presents a dilemma: necessary psychiatric medication worsens acne. Options include discussing alternative mood stabilizers with your psychiatrist if possible, combining lithium with aggressive acne treatment, or managing the acne psychiatric medication trade-off consciously. Antipsychotic medications sometimes worsen acne through various mechanisms, though the effect is variable and many antipsychotics don't significantly affect acne. Discussing medication side effects with your psychiatrist helps identify if acne worsening is medication-related. SSRIs, antidepressants, generally don't worsen acne and might indirectly improve it by reducing stress. However, individual variation exists. Stimulant medications for ADHD don't typically worsen acne directly, though sleep disruption from stimulants might worsen acne indirectly through stress and sleep deprivation effects. Mental health in acne is particularly important for individuals with pre-existing depression or anxiety. Acne's psychological burden can exacerbate pre-existing psychiatric conditions. Recognizing this and providing both dermatological and psychiatric support is important. Medication compliance for acne treatment might be compromised in individuals with depression or ADHD. Depression reduces motivation, and ADHD can cause forgetfulness. Building medication adherence support, reminders, routine integration, accountability, helps overcome these barriers. Discussing psychiatric medications and acne concerns with your psychiatric provider helps identify which medications, if any, might worsen acne. Sometimes alternative medications without acne side effects exist. Coordinated care between dermatology and psychiatry optimizes outcomes. Each provider should be aware of the other's concerns and treatments. Guide 66, Acne Treatment and Pregnancy, Safe Options and Contraindications. Pregnancy significantly constrains acne treatment options due to risks of medications to the fetus. Understanding safe treatments during pregnancy allows continued acne management while protecting fetal health. Absolutely contraindicated during pregnancy, isotretinoin, severe teratogen-causing birth defects, tretinoin and other prescription retinoids, significant teratogenic risk, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. Guide 61, Understanding Acne in Specific Sports and Athletic Activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62, Acne Treatment During Immunosuppression and Immune Compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Community health workers trained in acne management can provide guidance and treatment in areas lacking specialist dermatology. Telemedicine potentially extends access to professional dermatology even in resource-limited areas, though internet access is necessary. Simple, low-cost interventions, sun protection, hygiene, lifestyle optimization, remain effective even without expensive treatments. Guide 85, Acne and Gender, Sex-Specific Differences and Considerations. While acne affects all genders, sex-specific hormonal and social factors create gender differences in acne experience, warranting gender-specific understanding. Female acne often involves hormonal cyclicity, often concentrating around menstrual cycle phases. Males lack this cyclicity, experiencing more constant acne patterns. Hormonal treatments, oral contraceptives, spironolactone, are standard for female acne but generally inappropriate for males. Males rely on topical treatments and antibiotics primarily. Female-specific acne considerations include menstrual cycle tracking, potential birth control side effects, and pregnancy precautions with acne medications. Male acne might be more severe on average due to higher baseline androgens. However, severe acne affects all genders. Facial hair in males makes treating acne challenging. Beard covers facial acne and prevents topical treatment application. Facial hair also traps moisture and bacteria. Some males benefit from beard care modifications or shaving strategy adjustments. Societal appearance pressure affects genders differently. While appearance standards affect all genders, women might face intensified appearance-focused judgment. Recognizing gender differences allows appropriate, gender-sensitive treatment approaches. Guide 86. Acne Scarring Prevention During Active Treatment. While scarring is addressed post-acne, prevention during active acne treatment is more effective than treating scars after they form. Preventing deep inflammation, which causes scarring, is paramount. Aggressive acne treatment preventing severe lesions prevents scarring more effectively than treating scars afterward. Avoiding picking, squeezing, or extracting acne is crucial for scarring prevention. This is perhaps the single most important scarring prevention strategy. Treating acne early prevents it from reaching severity levels causing scarring. Early intervention prevents worse scarring than treating established severe acne. Professional acne management, particularly using isotretinoin for severe acne, prevents deep inflammation that causes scarring. Waiting years trying home treatments before seeking professional help allows scarring to occur that could have been prevented. Post-inflammatory hyperpigmentation prevention through sun protection prevents darkening of healing acne that makes scars more visible. Barrier health maintenance during treatment prevents excessive irritation that might promote deeper inflammation and scarring risk. Understanding that scarring prevention is more effective than scar treatment motivates appropriate early intervention for severe acne. Guide 87. Acne and Beauty Standards, Challenging Appearance-Focused Culture. Acne exists within broader cultural beauty standard contexts. Understanding and challenging appearance-focused culture helps reduce acne-related distress. Beauty standards have varied historically and culturally, showing that current standards are culturally constructed, not universal truths. Overemphasis on flawless appearance in media and advertising creates unrealistic expectations. Recognizing that almost everyone has occasional skin imperfections helps maintain perspective. Influencer and celebrity appearance standards are curated through makeup, filtering, professional photography, and often procedures. Comparing yourself to these unrealistic standards damages self-esteem. Diverse beauty standards across cultures show multiple ways to be beautiful. Recognizing beauty beyond clear skin reduces acne's psychological impact. Challenging personal internalized beauty standards, recognizing you can be valuable and attractive with acne, reduces acne-related distress. Supporting others in valuing themselves beyond appearance helps shift culture away from appearance obsession. Advocating for more realistic, inclusive beauty standards in media reduces social pressure perpetuating appearance anxiety. Guide 88, Acne Treatment Adherence and Habit Formation Science. Understanding adherence and habit formation improves your ability to maintain treatment consistency long-term. Habits typically form through repetition. Repeating skincare routines consistently for 2 to 3 months makes them increasingly automatic, reducing conscious effort required. Environmental design supporting habits increases consistency. Placing skincare products visibly, creating dedicated skincare spaces, and removing friction, having products easily accessible, supports adherence. Cue-based habit formation, attaching skincare to existing habits like brushing teeth, increases consistency compared to time-based cues. Remember to do skincare. Reward associations with skincare, pleasant-smelling products, enjoyable ritual, positive reinforcement, increase adherence through positive conditioning. Accountability partnerships where you report to someone, friend, family, online community, increase consistency through social commitment. Motivation fluctuates. Understanding that motivation naturally varies and developing systems that work regardless of motivation, habit, routine, environment design, helps maintain adherence despite motivation fluctuation. Self-compassion toward occasional lapses prevents them from derailing entire routines. Missing a day occasionally doesn't mean failure. Restarting immediately prevents occasional lapse from becoming permanent abandonment. Guide 89, Acne and Sensory Sensitivities, Managing Treatment for Sensitive Individuals. Individuals with sensory processing sensitivities, common in autism, ADHD, and sensory processing disorders, might struggle with standard skincare routines. Adaptations help these individuals maintain treatment compliance. Sensory preferences vary individually. Some find strong scents overwhelming, others find unscented products leaving no sensory feedback. Understanding your sensory preferences guides product selection. Texture sensitivities affect product tolerability. Lightweight serums might feel pleasant while thick creams feel cloying. Smooth absorbing products feel better than sticky formulations. Temperature sensitivities might affect water temperature for cleansing. Some prefer cool water, others slightly warm, never hot, which damages skin. Routine predictability helps sensory-sensitive individuals. About acne biology helps reduce stigma. Advocacy for acne as legitimate medical concern, not purely cosmetic, helps ensure insurance coverage and professional attention. Acne affects mental health, self-esteem, and quality of life. It's not just appearance. Supporting those with acne through listening, normalizing their experience, and avoiding acne stigmatizing statements helps. Telling someone, just wash your face, or everyone gets acne, get over it, minimizes their legitimate struggles. Pushing for better acne education in schools helps teenagers understand acne and proper treatment earlier. Supporting dermatology access for all people regardless of income helps ensure everyone can access appropriate care. Advocating for inclusive acne research including diverse skin types ensures treatments developed work for everyone. Guide 80, Acne and the Senses, Smell, Touch, and Sensory Aspects of Skincare. Beyond visual appearance, acne and skin care involve other senses affecting experience and compliance. Smell of skin care products affects whether people enjoy using them. Pleasant-smelling products increase compliance due to positive association. Some people prefer fragrance-free products to avoid irritation or strong smells. Touch sensations affect compliance. People enjoy using products that feel good on skin. Smooth absorbing serums feel better than sticky formulations. This affects long-term routine adherence. Texture of products affects experience. Lightweight, smooth textures feel pleasant. Heavy, thick products feel uncomfortable, affecting compliance. Taste concerns arise if people accidentally get acne products in mouth, those should be avoided. Topical products shouldn't taste good, discouraging accidental ingestion. Sensory sensitivities, common in autism, sensory processing disorders, might affect product tolerability. Lightweight, minimally fragrant, smooth-textured products work better for sensory-sensitive individuals. Enjoyable sensory experience with skincare products increases likelihood of long-term compliance. Choosing products you enjoy using, good smell, nice texture, pleasant feel, supports routine adherence. Guide 81, Acne Recovery and Psychological Healing Post-Treatment. After achieving clear skin, psychological healing, moving past acne-related trauma, anxiety, or self-image damage, matters as much as physical healing. Cognitive reframing of acne experience recognizes acne as surmounted challenge rather than permanent identity. I had acne and overcame it differs from I am acne-prone in psychological impact. Rebuilding self-esteem after acne involves recognizing beauty and worth beyond skin appearance. Therapy or self-help work might support this. Managing residual anxiety about future acne recurrence is important. Some anxiety is adaptive, maintaining treatment compliance, but excessive worry isn't. Balance maintaining treatment with accepting that occasional breakouts don't mean failure. Celebrating clear skin and the journey to achieve it acknowledges the effort and success. This positive reinforcement supports continued treatment compliance. Relationships and social anxiety that develop during severe acne might persist even after clear skin. Gradual re-engagement in avoided activities supports recovery. Professional mental health support helps process acne-related psychological impact if significant trauma occurred. Guide 82, Acne and Climate Change, How Environmental Factors May Shift Acne Patterns. As climate changes, acne patterns and triggers might shift. Understanding climate-acne relationships helps anticipate these changes. Increasing temperatures in many regions mean more heat-driven acne. Sweat production increases with heat, increasing occlusion-related acne. Climate change's warming trend might increase acne prevalence. Increased humidity in some regions promotes bacterial growth and acne. Drier climates in other regions increase barrier compromise, contributing to acne. Increased air pollution from climate change effects worsens acne through oxidative stress and particle occlusion. Seasonal shifts might change acne seasonality patterns as climate changes. Increased stress from climate-related anxiety might affect acne through stress hormone pathways. Water quality changes from climate change might affect acne through different water exposure. While current climate change effects on acne are not yet clearly documented, these theoretical relationships suggest acne patterns might shift with climate. Being adaptable in acne management as environmental factors change is prudent. Guide 83, Acne in the Digital Age, Social Media, Online Communities, and Misinformation. Social media and online communities have transformed acne experience. Understanding digital age acne realities helps navigate benefits and pitfalls. Social media's focus on flawless appearance increases appearance anxiety and acne-related distress for some. Comparing yourself to filtered, edited images causes unrealistic expectations and self-esteem damage. Curated social media images where people show only their clearest skin days or use heavy filtering distort reality. Recognizing that everyone has imperfect skin days helps maintain perspective. Online acne communities provide support, shared experiences, and practical advice. These communities normalize acne and reduce isolation. Misinformation about acne spreads rapidly online. Evaluating source credibility and distinguishing evidence-based information from marketing or myth is important. Online acne forums sometimes feature unverified treatment claims. Being skeptical of anecdotal stories and seeking professional guidance for unusual claims protects you. Telemedicine dermatology accessed online expands access to professional care, beneficial for those without nearby specialists. Online skin analysis apps using AI might provide useful guidance but shouldn't replace professional assessment. Limiting social media exposure, particularly comparing images, supports mental health during acne treatment. Guide 84: Acne Treatment in Resource-Limited Settings. Many people globally lack access to standard acne treatments. Understanding available low-cost options and treatment adaptations helps those with limited resources. Over-the-counter benzoyl peroxide and salicylic acid are often affordable and available globally, even in resource-limited settings. These should be first-line treatments where available. Local botanical treatments, tea tree oil, neem oil, honey, used traditionally sometimes have evidence supporting their use. These are often affordable and locally available. Oral antibiotics, generic doxycycline, tetracycline, are often inexpensive in resource-limited settings, making oral antibiotic treatment accessible. Isotretinoin might be unavailable in many countries due to cost or regulatory restrictions, limiting treatment for severe acne without this option. Professional dermatology care might be unavailable or prohibitively expensive. Training non-specialist healthcare providers in basic acne treatment helps extend care availability. Oral antibiotics don't significantly affect athletic performance at prescribed doses. Athletes can safely use oral antibiotics for acne without worrying about performance impacts. Spironolactone, if used by female athletes, is not banned in professional sports and doesn't directly affect performance, though it's a diuretic potentially affecting hydration. Athletes using spironolactone should ensure adequate electrolyte and fluid intake. Isotretinoin doesn't affect athletic performance. However, during isotretinoin treatment, skin is photosensitive and sometimes irritated, which might temporarily affect comfort during training. Otherwise, no performance impact. Retinoids don't directly affect athletic performance. Some concerns about sun-sensitizing acne treatments affecting outdoor athletes are legitimate. Sun-sensitizing treatments require extra sun protection for outdoor athletes. Using high SPF sunscreen that's sweat-resistant and reapplying frequently is necessary. Anxiety about acne potentially affecting performance is psychological rather than physiological. If acne causes confidence loss that affects athletic performance, treating acne improves performance through psychological mechanisms. Conversely, improved mental health from treating acne often improves athletic performance. The overall effect of treating acne in athletes is typically positive. Improved mental health, confidence, and well-being generally improve or maintain athletic performance. Guide 73, Acne Treatment Costs, Insurance Coverage, and Affordable Options. Cost of acne treatment varies dramatically based on treatments selected and whether insurance covers them. Understanding costs and coverage options helps make affordable choices. Over-the-counter topical treatments, salicylic acid, benzoyl peroxide, retinol, cost $5 to $30 per product and are usually affordable. These are often effective for mild to moderate acne. Prescription topical treatments, tretinoin, adapalene, azelaic acid, cost $20-$100 plus per month depending on insurance. Generic versions are often affordable, brand name versions cost more. Oral antibiotics, doxycycline generic, cost $10 to $30 per month typically, making them affordable. Oral isotretinoin can be expensive, $200-$500 plus per month, even though the generic is relatively affordable. However, insurance typically covers isotretinoin for severe acne, bringing costs down significantly. Without insurance, isotretinoin can be prohibitively expensive. Spironolactone generic is inexpensive, $10 to $30 per month, making it affordable. Oral contraceptives for hormonal acne range from $20-$100 plus monthly without insurance, though many are quite affordable. Insurance typically covers at least some options. Professional treatments, chemical peels $150 to $300, laser $400-$1,000 plus, microneedling $200 to $400, are expensive and insurance rarely covers them. However, they might be worth pursuing if home treatment's insufficient. Insurance coverage varies widely. Some insurances cover prescription acne treatments generously while others cover minimally. Checking your insurance coverage for your specific treatments helps plan. Dermatology visits cost $100-$300 plus without insurance. Some dermatologists offer sliding scale fees for uninsured patients. Community health centers often provide affordable dermatology care. Affordable acne management strategies. Start with over-the-counter treatments. Use generic prescription medications if needed. Ask dermatologists about patient assistance programs for expensive medications. Consider community health center dermatology if cost is barrier. Check insurance coverage before treatments. Many effective acne treatments are affordable. Cost shouldn't prevent access to basic acne treatment, though advanced professional treatments may be limited by budget. Guide 74. Traveling with acne and maintaining treatment consistency. Travel disrupts routines and changes in water, climate, and environment sometimes affect acne. Planning ahead helps maintain acne treatment consistency while traveling. Packing acne treatments. Bringing full-size bottles takes space and weight. Travel size containers, available at most pharmacies, help. Decanting products into smaller bottles also works. Ensure all liquids comply with airline regulations if flying. Jet lag affects sleep quality and can worsen acne through stress and hormonal disruption. Prioritizing sleep adjustment and jet lag management helps minimize acne worsening from travel. Different water quality in travel destinations affects skin. Hard water or heavily chlorinated water might irritate skin. Using bottled water for rinsing face, or adapting cleansing to account for different water, helps minimize water-related skin issues. Different climates affect acne. Traveling to humid climates from dry climates or vice versa might temporarily worsen acne as skin adjusts. Using moisture-appropriate products for the destination climate helps. Stress from travel worsens acne. Stress management during travel, exercise, meditation, sleep prioritization, helps manage stress-related acne worsening. Maintaining routine is important. Even if traveling, continuing your acne treatment routine helps maintain clarity. Making treatment part of your travel routine, like packing it with toiletries, helps ensure consistency. Some travelers experience travel acne from new environments, water, or stress despite normally clear skin. Understanding this is temporary and will resolve upon return helps maintain perspective. Professional treatments aren't practical while traveling. Continuing topical treatments and avoiding new triggering factors is realistic goal during travel. If traveling long-term, weeks or months, establishing local dermatology care if treatments need refilling helps maintain continuity. Guide 75, Acne in Specific Professions, Pilots, Surgeons, Healthcare Workers, and Others. Certain professions have acne-promoting environmental factors. Understanding profession-specific acne factors allows appropriate prevention. Pilots and flight crew experience repeated altitude changes, cabin air pressure, dry air, and frequent travel jet lag, all acne-promoting factors. Additionally, time zone changes disrupt sleep and stress levels. These workers benefit from aggressive acne prevention and hydration strategies. Surgeons and healthcare workers wear masks for prolonged periods, creating occlusion and friction-related acne under masks. The pandemic increased mask-related acne awareness. Prevention includes mask breaks when possible, changing masks frequently, keeping skin under mask clean and dry, and using non-comedogenic products. Chefs and kitchen workers are exposed to heat, steam, and severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Seasonal adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 61: Understanding acne in specific sports and athletic activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne Treatment During Immunosuppression and Immune Compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne stimulating sebaceous gland activity and follicular changes. This is why adolescent acne is so common and often severe. Acne's psychological impact during adolescence is particularly significant due to developmental sensitivity about appearance and social dynamics. Acne during formative teenage years can cause lasting psychological effects. Taking adolescent acne seriously and treating it appropriately is justified. Guide 98: Acne and Body Dysmorphic Disorder, Distinguishing Clinical Concern from Pathology. Body dysmorphic disorder, BDD, is excessive preoccupation with perceived appearance flaws, sometimes involving acne. Distinguishing between appropriate concern about actual acne and BDD helps ensure appropriate treatment. Normal acne concern involves recognizing acne exists, wanting to treat it, and feeling moderately bothered. This is appropriate and doesn't indicate pathology. BDD involves disproportionate distress about minor or imagined flaws, repetitive behaviors, mirror checking, skin picking, comparing, significant functional impairment, and disproportionate appearance focus. Someone with BDD focused on acne might have minimal actual acne but experience severe distress and dysfunction from perceived severe acne. BDD requires mental health treatment, therapy, sometimes medications, rather than dermatological treatment alone. Treating actual acne doesn't resolve BDD if actual acne isn't the primary problem. Recognizing BDD allows appropriate referral to mental health providers. Dermatologists familiar with BDD can identify it and recommend mental health evaluation. Having actual acne doesn't preclude also having BDD. Someone might have real acne and also have disproportionate BDD-related distress. Guide 99, Acne Treatment Optimization through N of 1 Experimentation. N of 1 trials involve testing treatments in yourself systematically to determine what works best for your specific skin. This personalized approach optimizes your individual treatment. N of 1 testing involves trying one treatment change at a time, tracking results objectively, comparing periods with and without treatment. For example, testing whether dairy worsens your acne. Eliminate dairy for 4 weeks while maintaining everything else constant, track acne objectively, then reintroduce dairy and track acne again. If acne improved without dairy and worsens with dairy reintroduction, dairy is likely a personal trigger. Similarly, testing whether specific products, ingredients, stressors, or other factors affect your acne using single-variable experimentation personalizes your treatment. Tracking variables, diet, sleep, stress, products used, acne status, in a detailed journal enables N of 1 analysis revealing personal patterns. This personalized approach identifies your specific acne triggers and treatment responses better than general recommendations, since everyone's acne differs. Guide 100, Acne Future, Emerging Research, Potential Breakthroughs, and What's Next. Acne research continues advancing, with numerous promising approaches under investigation. Understanding emerging research provides hope for improved future treatments. Microbiome-targeted treatments using probiotics or postbiotics specifically addressing acne-associated microbiota changes are in development. These might provide more targeted bacterial management than broad-spectrum antibiotics. Precision medicine approaches using genetic testing to predict acne predisposition and treatment response are emerging. Personalized treatment based on genetic profiles might become reality. Immunotherapy approaches boosting immune response to acne bacteria or reducing inflammation are under investigation. Nanotechnology delivery systems enabling more targeted, deeper drug delivery are advancing. Future treatments might be more effective and have fewer side effects through optimized delivery. Gene therapy approaches, still experimental and far from clinical use, might eventually target genetic predisposition to acne. Plant-based and botanical treatments with stronger evidence are being developed. Future treatments might offer natural alternatives to synthetic drugs. Combination approaches targeting multiple acne mechanisms simultaneously are increasingly recognized as optimal. Future standard treatment might involve coordinated multi-mechanism attacks on acne. Artificial intelligence continuing to improve might eventually enable excellent personalized treatment selection and monitoring. Understanding that acne science advances constantly provides hope. Treatments available today vastly exceed what existed 20 years ago. Future treatments will likely be even better. Your acne is treatable now with current treatments. However, if current treatment's insufficient, future advances might provide new options. Either way, clear skin is achievable. Starting with gentle treatments is appropriate for adolescents. Many teenagers' skin is quite resilient and tolerates strong treatments well, but starting conservatively establishes good habits. Teaching proper skincare techniques during adolescence establishes lifelong habits. Involving adolescents in treatment decisions increases compliance. Understanding why treatments are recommended, how to use them properly, and what results to expect improves adherence. Adolescents who feel involved in their treatment are more likely to stick with routines. Addressing acne myths prevalent among adolescents: chocolate causes acne, poor hygiene causes acne, etc., prevents reinforcing false beliefs and harmful behaviors. Professional dermatology involvement is appropriate even for moderate adolescent acne, as dermatologists can recommend appropriate treatments and monitor for complications like scarring. Discussing how acne affects emotional well-being opens conversations about mental health support if needed. If acne is causing depression or anxiety, professional mental health support should be offered. Realistic expectations help adolescents understand that acne improvement takes weeks to months, not days. Understanding this prevents discouragement. Guide 68: Acne in Older Adults, Age-Related Changes and Treatment Adjustments. Acne persisting into or developing in older adults has unique characteristics requiring age-specific management adjustments. Adult acne in those over 40 or 50 is often hormonally driven, particularly in women during perimenopause and menopause, and typically more inflammatory than comedonal compared to teenage acne. Aging skin is appearance-related anxiety helps reframe negative thoughts about acne, reducing anxiety and depression related to appearance. Specialized dermatology (CBT) combines skin condition understanding with psychological techniques for optimal outcomes. Acceptance and Commitment Therapy (ACT) helps people accept current skin status while committing to valued activities despite appearance concerns. This approach reduces appearance-focused anxiety while maintaining motivation for treatment. Body image work addressing distorted thinking about appearance supports mental health alongside medical treatment. Body dysmorphic disorder screening is important for those with disproportionate appearance distress. Mindfulness practices reduce appearance-focused anxiety and rumination, supporting mental health during treatment. Dermatology apps using AI analyze skin photos to assess acne severity, identify acne types, and recommend treatments. While some apps show reasonable accuracy for basic assessments, they can't match professional dermatologists for complex cases. These apps serve best as supplements to professional care rather than replacements. Accuracy of AI skin analysis varies. Higher quality apps with larger training datasets and professional validation generally perform better than those lacking proper development. However, all AI assessments have limitations and should be verified by professionals. Personalization algorithms use your skin characteristics, responses to past treatments, and various data points to recommend optimized treatment approaches. As these systems improve and accumulate more treatment outcome data, personalization effectiveness likely improves. Currently, these tools remain supplements to professional judgment rather than replacements. Telemedicine AI-assisted dermatology allows remote consultations where AI supplements the dermatologist's assessment. This can improve access to dermatology for people without nearby specialists. Privacy considerations are important with AI skincare apps. Your skin data is sensitive. Understanding how your data is used and stored matters when choosing AI tools. Guide 44: Peptide Therapies and Bioidentical Hormone Treatments. Advanced peptide therapies and bioidentical hormone treatments represent frontier approaches for acne management. Understanding these options helps you discuss them with your healthcare provider. Specific peptides stimulate collagen production and support skin barrier healing. For acne management, peptides primarily support post-acne recovery and scar treatment rather than treating active acne directly. Peptides appear in many premium skincare products. Bioidentical hormone replacement therapy, BHRT, uses hormones chemically identical to your body's natural hormones. For hormonal acne, bioidentical estrogen and progesterone might theoretically provide benefits similar to synthetic hormones in oral contraceptives with theoretically better tolerability. However, evidence for BHRT's superiority for hormonal acne is limited. Additionally, BHRT is more expensive and requires more individualized monitoring than standard hormonal contraceptives. Compounded bioidentical hormone prescriptions allow customization of hormone dosing and ratios. For severe hormonal acne, compounded BHRT might be appropriate, though professional oversight is essential. Guide 45. Nanotechnology in acne treatment. Nanotechnology enables delivery of active ingredients at microscopic scale for potentially enhanced effectiveness. Understanding nanodelivery systems helps you evaluate next-generation acne products. Liposomal formulations encapsulate active ingredients in microscopic lipid spheres, enabling enhanced penetration and stability. Liposomal retinol or liposomal benzoyl peroxide potentially provide enhanced effectiveness with reduced irritation through optimized delivery. Products using liposomal technology are increasingly available commercially. Nanoparticles of active ingredients increase surface area and bioavailability, potentially enhancing effectiveness. Nano-sized acne actives are being researched for enhanced skin penetration and efficacy. Sustained-release nanotechnology enables gradual release of actives over extended periods, potentially maintaining consistent therapeutic levels with less frequent application. Guide 46. Environmental and climate adaptation strategies for acne. Acne management must adapt to different climates and environmental conditions. Understanding climate-specific strategies optimizes treatment across varying conditions. Tropical climates with heat and humidity increase sebum production and bacterial growth. Strategies include more frequent cleansing, lighter formulations, focus on oil control, increased sun protection. Sun worsens heat-related acne, air conditioning when possible, and increased frequency of active acne treatments. Guide 50. Acne success stories, effective patterns, and realistic timelines for clear skin. Examining successful acne treatment patterns and realistic timelines helps set expectations and maintain motivation during treatment journeys. Most people achieve significant acne improvement, 70 to 80% clearing, within 12 weeks with appropriate treatment. Complete clearance often takes 4 to 6 months. Severe acne or scarring might require 6 to 12 months or longer. Successful patterns often involve early professional intervention for moderate severe acne, combination approaches addressing multiple acne factors, consistent routine adherence, lifestyle optimization alongside treatments, patience